Hi, everyone. My name is Abby Simon. I'm a clinical social worker at the True Center for Gender Diversity here at Children's Hospital Colorado, and I use she, her pronouns. My goal today is to talk to you a little bit more about gender, what it means, and how it interacts with your work, and how you can help to create safe and inclusive spaces for gender diverse people. Let's get started. So what are we going to accomplish today? Today, the first thing we're going to talk about is what gender is. And once we sort of outline that piece, we'll talk about why gender is an important factor to look at and why gender matters in your work. And then from there, we'll sort of review best practices. We'll look at language, gender literacy, creating safe spaces, and then kind of some equine specific pieces, and then provide you with some resources for more information. So the goal of today is to really help you feel more comfortable working with gender diverse people and to know what that means and looks like. So let's get started. What is gender? I think a lot of people think it's that picture on the left with the box, that it's box A or box B, female or male. What we know about gender as we learn more and more about it is it actually probably looks a lot more like this ball of yarn. There's many, many different layers and many, many different pieces to this. A lot of people think that gender is anatomy. We'll go in the next slide and talk a little bit more about the different components of gender, but that's actually just one component of gender. And I think it's really important to recognize and remember that gender is a social construct and that throughout history we've seen different societies have different numbers of gender and different ideas of what gender means and different frameworks for gender norms. So we look at it as this complex set of both social norms, biological factors, all kind of wrapped into one complex thing that we name as gender. So what are those different pieces? What does it look like? And how do we sort of expand our view besides anatomy? And that is where the genderbread person comes into play. So the genderbread person is something we use with lots of our clients here to sort of talk about the different dimensions of gender. So the first dimension of gender, I'll start with the easiest one, is anatomy. So are you born with what we would quote unquote call female anatomy, male anatomy, or somewhere in the middle? Most of those people identify or may identify as intersex. So that has a lot to do with our bodies. I think that's where many people's idea or concept of gender stops. That one I think we all get. So if you're looking at this graphic here, that would be that middle line, biological sex. The next piece we think of when we talk about gender is gender identity. So if anatomy is what's between your legs, then gender identity is what's between your ears. It's how you see yourself. It's your self-concept. So do you think about yourself as female? Do you think about yourself as non-binary, as questioning male, agender? We'll go over some of these terms later, so don't worry if you don't know them now. But how do you see yourself? What's your self-concept? So an important thing to remember about gender identity is that only that person can really ever know how they see themselves. The next piece, which is different than gender identity, is called gender expression. So going to that middle yellow line there. So gender expression is all the ways that we act out our gender. So gender expression is the clothes we wear, how we do our hair, how we speak, our mannerisms, all the cultural components around gender. So this is a really key piece to recognize that this is absolutely a social construct. One thing to keep in mind is that, 100 years ago, it was very typical to put baby boys in pink and baby girls in blue. So 100 years ago, if you saw a baby who was dressed in pink, your absolute assumption would be that that was a male baby. Obviously today, those have been reversed. So a lot of what we do is take these things, which in and of themselves, right, a color doesn't have a gender, and we gender them. We say, girls like this, boys like that, people do this way, people do that way. And in that sense, we all have this cultural expression of gender, which we call gender expression. The next piece goes into how do we relate to other people? And that's where we have this piece around sexual orientation. So sexual orientation is completely and totally separate from gender. How it interacts is how we think about ourselves in terms of who we're attracted to. So I view myself as a female, male, non-binary person, and I'm attracted to any number of different people from that space of my own gender identity. The other pieces like around commitment style, so that's just a sub piece around sexual orientation, which we won't talk about as much today. So important to note that people can be anywhere on this scale with any of these different things. So we could have someone who has a female gender identity and androgynous to male gender expression and is biologically female. Or we could have somebody who is biologically male, gender expression as female, gender identity as female. So any of these things, any of these lines, and it's kind of helpful to look at all of these different lines, those all function very separately from one another and can really be completely independent pieces. I think probably the biggest place where people get confused is, okay, well, if this person dresses like a boy, talks like a boy, acts like a boy, does that mean that they now are a boy, even though they are anatomically female? And that may or may not be the case. So we work with some patients and some young people who say, absolutely, my gender expression is matching my gender identity. And other people say, actually, all of these pieces feel very different. I'm in different spaces for all of them. So those are our main components of gender. So gender is a social construct, and it's made up of these social and biological constructs, and it's made up of these pieces. So I'm going to do a few sort of reframes of some myths that I think that are out there around gender. Some of these we've already touched on a little bit in that last slide. So the first one is that gender is fixed and stable. So that is true for some people. There are some people who are born and their gender remains the same throughout their entire life. For lots of people, gender is more of a fluid process and an evolution. So they may move between different gender identities, and we'll go into in just a minute here all the different types of gender identities that one may have. But someone might identify as female and then identify as male and then identify as non-binary. And I think it's important that we don't hold any judgment around that and recognize that this is a part of human experience and can move and change and can also stay the same. So, I hear a lot, well, is this person going through a phase? There are people whose gender identity changes. And I don't know I think that phase could be one word to describe that. But I think it's also important to recognize that for some people, this is a process of cultivation. So we talked already about how each part of gender can function independently and people can sort of be in a different space or be in a different place on each of those spectrums, and that they don't necessarily have to line up. Gender is not sexuality. We touched on that. So is gender diversity normal? So I hear the question a lot, like, why is this gender diversity piece just coming out now? When I grew up, this wasn't there. We weren't talking about this. What's happening that this is now just occurring? So I would say that from our space, the philosophy on that would be that gender diversity has always existed. It's existed in lots of different cultures in lots of different ways. And we can look back in history and note that gender diversity has always existed. I think we are now in a current space and time where gender diversity is okay to talk about, and there are fewer consequences, if you will, although there are definitely still some, and we'll talk about that in a little bit, about expressing your gender identity. But I think people feel more comfortable to talk about it and explore it and have that be an open and honest conversation. And I think that's why we're seeing higher numbers of gender diverse people. So we'll talk a little bit. This may or may not need medical treatment. Let's talk about that. I think that there is sort of this assumption that if people are gender nonconforming, meaning that they don't fit the rules or the norms that we ascribe to each gender, that they will seek medical treatment or that they will go through transition or even that they may identify as transgender. And I can say that all of those things are not true. So there's a big difference between what we could call a gender nonconforming person and a person who would identify as transgender. So gender nonconforming would be somebody who again just doesn't meet our expectations of that's not what a woman should look like, or that's not how a man acts. So those are people who maybe have traits or interests or gender expression that we would align with something other than the gender with which they identify as. That's gender nonconforming. A lot of gender nonconforming people are completely at home and happy and feel safe and wonderful in their bodies. And so they don't actually go on to seek any type of medical treatment. That's them, that's who they are, that's great. We also see people for what we would call a diagnosis, although I don't quite agree with that terminology. It is in the DSM-5 or the Mental Health Diagnostic Manual, which would be called gender dysphoria. So gender dysphoria means that someone's gender identity is not in line with their body and that's causing them distress. So the discrepancy between their body and their gender identity is making it difficult to be in their body, and it feels uncomfortable to be in their body. Those people, again, may or may not identify as any number of things, but the actual body distress is what we can treat medically in terms of helping people align their bodies in ways that make it feel more comfortable. So if someone was born with a more estrogen-based body and a vagina and breasts, and having breasts made them feel very uncomfortable, that might be something that they would look at taking, having a surgery to remove breasts, and then also potentially taking testosterone to enhance the secondary sex characteristics that would make them feel more comfortable with a male gender identity. So that's the kind of broad overview of what gender is. And now I think it's key to sort of talk about, why is this important to think about? There's so many different parts to the human experience. Why look at gender? Why add this to the radar or grow our understanding or our interest in this? And I would say that gender is a pretty key function of how we interact as human beings. So one thing that you can do to sort of get an idea of gender is potentially to just pick a day and actually just think about how many times gender interacts throughout your day. So how many times in a conversation someone uses him, her, they, them, ma'am, sir, uses a gender stereotype or a gender bias to sort of look at how they're interacting with you. And then think about, if that didn't line up with how you thought about yourself, the difficulty of having that dissonance be present in almost every single interaction that we have. And so for people who are gender diverse and who are not seen or recognized as their gender identity, that can be a pretty pervasive experience that someone is feeling all day, every day. One of the ways that I sort of visualize this for lots of the kids that we work with is it's almost sort of like having a hand in front of your face, because you can't sometimes see past your gender in terms of, if you and I are speaking and you are misgendering me and I identify as female. So if you are misgendering me and calling me sir, likely I'm more focused on you calling me sir than actually hearing what you're saying, because that feels so unresonant and difficult. And so I work with kids who feel like gender is here and it's really the only thing they can see, and they can't really talk to or engage in lots of things because gender is so pervasive. And our goal is to really help gender for most of our kids be kind of more out here in terms of it's part of their day and it's part of what it looks like, but they're also able to see and incorporate so many other experiences rather than that feeling of people aren't seeing me. So I think we can recognize that our system is set up to be pretty binary, pretty male or female, and that most of our world functions in that way, in you're in this box or in that box. And I'm going to take a minute here to talk more about the implications of that for gender diverse people, and also kind of better understand some of the challenges that they have so that we have an idea of when you're working with gender diverse people, maybe some of what their experience has been and some of potentially what they have encountered in the world. Before I talk about some of the kind of sad or the statistics that are unfortunate and reflect how we as a culture can change, I want to talk a little bit more about something that I think Joanna Olson, who has done a lot of work around gender, stated in 2011. So she describes gender dysphoria, again, dysphoria being that discomfort that you have in your body around your body and your gender identity not matching. She describes gender dysphoria in childhood as a congenital condition of childhood, which, if left unsupported or untreated, may result in emotional distress, psychiatric morbidity, and high-risk behaviors. And I think what is so important about that is the may result in. And so before I tell you some of these statistics about gender diverse people's experience, I want to tell you that my personal experience is that I work with a lot of wonderful, compassionate, put together, unbelievably resilient young people who are thriving, not in spite of their gender identity, but in part because of their gender identity, and because they've learned so much about themselves in this process, and because their gender identity has taught them how to be advocates for themselves and for other people, and how to be empathetic, wonderful people. And I want to give you both sides of that picture. I want to show you that there are some risk factors for people, but that with our support and with encouragement and with people's own resiliency and just joy, that they can live really happy, wonderful, beautiful lives. We have tons of people who are now in college and doing well and in wonderful friendships and romantic relationships, and who are known and loved for their gender identity. So with that, I will jump into some of the real but less, a little bit more sad statistics. So just a really quick piece on prevalence. So in terms of transgender, about 1 in 200 people identify as transgender would be the most current data that we have. For me, a bigger piece of that is 9% of youth identify as gender expansive as of 2012. So it's really easy to think that this is sort of a pocketed issue, but when we think about the fact that almost 1 in 10 children identify as something other than their birth gender, it's important to look at gender diversity as a piece of the puzzle for a big chunk of that population. And even more interesting, well, another interesting piece around that is that of that 10%, only about a third of that 10% identify as transgender, meaning that 2/3 identify as something other than transgender, but not as cisgender. And cisgender means that your gender assigned at birth and your gender identity are matching. And we'll talk a little bit more about that later. So I just want to give you all a picture of how diverse the gender diverse community is and what that looks like. And then I think that in the past, there has been some data that sort of skewed. Well, in the past, I think there were probably more transgender female identifying people than there were transgender male identifying people. And wanted to let you know that now in Colorado, specifically per this data point, we have about an even split. So half trans men, half trans women. So what is it? What can it be like to be a transgender person? And I think that we know that historically for transgender people who have not been well supported and who this has been a harder process for, that there have been, higher rates of all of the above: anxiety, depression, substance use, suicidal ideation, suicide attempts, self-harm, homelessness, physical assault, sexual assault, body image issues, PTSD, unemployment, income levels under the poverty level, and sexual exploitation. So a pretty broad range of things that these people could be vulnerable to or could experience, related or unrelated to gender, but we know that there are those higher rates. So just to sort of drill into a few pieces a little bit more about where are these high risk factors, we'll talk a little bit more about mental health. So in terms of mental health, there are higher rates of attempted suicide, depression, self-harm, and experimentation with drugs and alcohol. I think this is important too to note, particularly as many people might be coming to you in sort of the scope of seeing this as something that would relate to medical practice, that there's a lot of stigma around medicine and what that experience will be like for gender diverse people. So we know that often many transgender people have been refused medical care, and that the fear of discrimination is often a barrier to care and leads to people delaying access to care. Also, we can look at things, such as, transgender adults avoiding using the bathroom at work or at school and getting, UTIs as a result. So there's some safety concerns around, how do I access these services? How are people going to respond to me in these services? What's my experience going to be like? And I think for a lot of people, they see the medical arena as a place that they can opt out of, as something that they don't have to do. We talked before about how many times throughout the day gender is an occurrence for these people in their lives, for everyone in their lives, and how that might be one place where you could have one less gendered experience that makes you feel not yourself or not seen or not respected. And I think it makes spaces that people are opting into even more important to be gender aware and to be gender supportive, because people often do have the choice to not do that. For our youth, just to talk a little bit more about school. So there are higher rates of dropping out, harassment, and bullying, and also some concerns around restroom use and feeling safe in their schools. So I think you can sort of see that overall, there are many spaces in which people could feel unsafe. There are also, on the flip side to that, so many places where people can feel safe and can feel seen and can feel supported. So that's sort of where we're going to move to next. How do we do this? How do we help people feel seen and safe and welcomed and supported in a way that creates the type of experience that you're hoping to have with your clients? So what can we do to be supportive of gender diverse people? The number one absolute most important thing is acceptance. And I think the first step to acceptance is really looking inside yourself. It's looking at your own gender norms, your own gender biases, your own experience of gender, and how that sort of creates whatever lens you're looking at the situation through. I think about and talk about and work with gender all day, every day, and I still find myself continually thinking about, how did I approach that situation? How did I say that? What gender expectations am I bringing to the situation, and how is that reflecting, and how is that changing how I'm interacting with this person? And gender is an embedded thing, right? I mean, what's the first question that people ask when a baby is born? Is it a boy or is it a girl? It's the very first thing that we use to identify people's sense of self. And so it's in there, and it's in there deep. And I just want to acknowledge that it can be a hard process to look at that, and it can be a hard process to change some pieces around gender. So acceptance is the absolute most important thing. Acceptance and what it takes for you to come to sort of understand some of these pieces of gender may or may not be a process. It's certainly been a process and continues to be a process for me. And I think it's important to own that. So to go back, acceptance is also important because acceptance does not have to come from any one place. So we know that for transgender students who have one supportive adult, that they're 2.3 times less likely to attempt suicide. 2.3 times. So we've cut that number almost in half. And that they're 1.4 times less likely to be bullied. So when this says one supportive adult, that does not mean a parent. That does not mean it has to be the most central figure in their life. It's one supportive person. It's a place in their life that they can come to and be seen for who they really are. And you can be that person. Even if someone's family isn't supporting, you can be the one person who accepts them for who they are. And I think it's important to remember that we have a lot of power, and that with the people that you work with, you're seeing them for who they really are could be an incredibly transformative piece in their life. So, and looking at best practices and looking at how we support people, one of the most important pieces to look at is the terminology. So some of learning about gender is almost like learning another language. There's lots of terms and there's lots of how do I say this and did I say this right? And it can be it can be a little scary and a little bit daunting. So we're going to talk both about terminology and then also about gender. How do we talk to people around gender, and then what are the right words, which I think are some of the biggest pieces initially to kind of getting over that hurdle with feeling comfortable around gender. Okay, so let's take a look at a few of the pieces around different gender identities. So gender identity, if you remember, is sort of how your self-concept, how you see yourself. So one gender identity might be somebody who would identify as gender nonconforming. Gender nonconforming has lots of different ways that people talk about that identity, which all have sort of subtle meanings. I think for today, we're just going to sort of lump those into gender nonconforming, although I recognize that they all have different meanings, and it can be important to investigate if someone identifies as genderqueer, what that means to them and why that would be different than gender nonconforming. But overarching term, gender nonconforming means that a person has behaviors, appearance, or an identities that's not congruent with their birth sex. So other terms for this could be genderqueer, gender fluid, gender creative, gender diverse, gender independent, or non-cisgender. There are, as I was saying that list, many more terms that popped up because the language around gender is constantly evolving and growing, which is really amazing. It's shifting to meet our growing understanding of the nuance of gender and build in different terms for more specific gender identities. So I'm always learning about new terms for gender identities and new ways that people identify. It's okay if you haven't heard of some of these things. My go-to question is always, tell me what that means to you. I think people are interested in sharing their experience if they want to, and they can tell you what that means, or they can tell you that they're not comfortable telling you what that means, and that's where we have Google. So then that's the broad brushstroke of gender nonconforming, and then we have transgender. So trans coming from the Latin root word across. So it literally means across gender or across the sex assigned at birth. So this is someone who does not identify with the sex that they were assigned at birth. So when I say sex assigned at birth, I mean that a baby comes out, a baby has a penis, and we decide that baby is a boy. We say, hey, your gender identity is male. A lot of people would say that there's not really enough information that person has to have a gender identity yet, but just to have a sex. So transgender is an umbrella term, meaning I do not identify with my sex assigned at birth or gender assigned at birth, right? For a lot of people, that can mean that they were identified male at birth, but that their gender identity is female, or that they were assigned female at birth and that their gender identity is male. So for some people, that means going from the male box to the female box or the female box to the male box. For other people, transgender means something else, and it means basically that they, again, don't identify with the gender assigned at birth. So the next piece is cisgender. So cis meaning same. So that's someone who was assigned female at birth and identifies as female. I think it's important to recognize that there's cisgender and transgender, and that we've given a terminology to both of those experiences. And just another quick piece. So when people talk about their gender or their gender identity, we often refer to that as their affirmed gender or their true gender, the gender that they see themselves as. So if someone was assigned female at birth and identifies as male, their affirmed gender would be male. So the next slide, I'm just going to run through some other terminology that you might hear or that might come up as you're working with gender diverse people, just to give you a quick sense of what some of these things mean. So if we're using that term transgender to mean moving from one of our binary categories to another, there's sort of two major categories. The first is male to female. So that's someone who was assigned male at birth and then transitioned to female. So that would be someone who may or may not identify as a transgender female. So when we say transgender female, it's sort of remembering that the gender that comes after the word transgender is someone's affirmed gender, not their birth gender. So then you could also say affirmed female. So then there's also female to male. So that's someone who is assigned female at birth and transition to male, and those people sometimes refer to themselves as transgender male or affirmed male. Oftentimes people don't identify as transgender and just say I'm male or I'm female. So sex reassignment surgery is what the also referred to as bottom surgery. So that's like that surgery with genitals. We now call that gender affirmation surgery. You'll also hear people talk about cross-sex hormones or gender-affirming hormones. So those are generally estrogen or testosterone, depending on your situation. And people take gender-affirming hormones, again, to kind of have the secondary sex characteristics of their affirmed gender. Gender dysphoria, we spoke about before. That's sort of that discomfort that comes with feeling like your body is incongruent with your gender identity. So that specifically speaks to that feeling of discomfort. And then gender dysphoria, that sort of diagnosis piece is gender identity disorder. Another piece that you might hear people say is stealth. So stealth usually means that people don't know that someone is transgender or gender diverse, and that they would like to, that's not something that's widely known. So often kids will go to school as stealth, meaning that maybe only their teachers or one adult in the school knows of their gender identity. And passing is a term that's used to sort of talk about somebody being seen more. There's another term called gender attribution, which means when we see someone, we look at sort of all the pieces of their gender expression, how they are expressing their gender, and we sort of automatically gender people, or it's a common practice to sort of automatically gender people. So if you see someone, I'm going to use some gender stereotypes here, who is wearing a dress and had long hair, you might assume that that person is female, right? So again, not sure that that's an assumption that we should be making, and I think it would be helpful to always check in with people around what their gender identity is. But passing sort of refers to being able to go into the world and have people assume your gender identity to be your affirmed gender identity. I hope you all are staying with me there. I know it gets a little bit complicated, and I'm sure you're not going to use all of these terms all at once, but I just want to give them to you all in one chunk so that if there's something that you are hearing, that you have some sort of awareness about what that looks like. So social transition for people who are transitioning from potentially, male to female, that would be changing name, changing dress, changing pronouns, behavior, any of those pieces that aren't necessarily related to changing your body per se. And then medical transition is more related to kind of the body piece of again, taking some of the cross-sex hormones or having gender affirmation surgery or some of those other pieces. And it's important to know that those are both completely independent parts of transition and can happen or not happen or happen in any combination of different ways that makes the person feel comfortable. So some people choose to not take gender affirming hormones. Some people do. Some people choose to have surgery. Some people don't. A number of different choices that people make. Again, the goal is always for that person to feel safe and comfortable in their body and their experience. And so whatever it looks like for that person to do that is sort of how those decisions are made. Another one is assigned male at birth. So people can refer to themselves as AMAB, or assigned female at birth, AFAB. So again, as I talked about before, language is this huge evolving piece around gender. And so there are so many other terms out there, but those are some of the main ones that you may or may not hear. Now we're going to sort of talk about gender literacy. So we've taken a moment to sort of talk about what is gender, why is it important to think about gender, why are gender diverse people potentially a vulnerable population and also a really resilient, amazing population. We've learned some of that basic terminology, and now it's time to look at how do we put that into practice. So if I'm working with somebody who is gender diverse, how do I ask them about this? How do we talk about gender? And I realize that can be a bit daunting. So let's go over some of the major kind of do's and don'ts. So these are kind of my big tips for what I would call gender literacy. So the first one is to avoid gendered language. This is so difficult. I struggle with this one every day. It's hard. It's been very hard to get rid of, the hey guys, which almost kind of feels at times gender neutral because we say that to potentially a group of people that all identify as female. But really looking at, how are you using gender in your language in ways that might be hard for someone. So we're kind of trying to move away from hi ladies, hello sir, hi guys, all those pieces that assume gender identity. Trying to use things like, hey everyone, you all, if you're talking about your client, the client, your child, to use things that are a bit more inclusive. Folks, people, everybody, writers, whatever works, but just trying to move away from that gendered language. Also talking about gender separate from anatomy. I think this might come up a little bit more for us in the medical space, but talking about anatomy in a way that doesn't link that anatomy to gender. So I can talk about people with penises and acknowledge that there are men with penises and women with penises, and that's okay. And that I don't need to make the assumption that anyone that has a penis has any type of gender identity, and just assume that that's a individual experience and that we can look at that for each person. So avoiding terms like male anatomy, female reproductive organs, and just talking about the actual part of the body. And then I think also trying to be as gender neutral as we can about that. So we could call something breast tissue, or we could call it chest tissue, right? Breast tissue being more of a gendered word and more something that we assign to female gender identity or female, and chest tissue being a little bit more neutral. So in the way that I speak, I talk about two things. I talk about someone how they were assigned at birth, and then their identity. And that's assuming that I know both of those pieces, and that's also assuming that both of those pieces are pertinent to what I'm talking about. So that's a nice way to be able to sort of talk about someone's potential anatomy and also their gender identity. So someone was assigned male at birth and identifies as female. And what's particularly impactful about this statement is that we are using the word assigned. So we're denoting that someone was assigned a gender identity that they had no control over. So we're saying this is what they were assigned, and then this is how they identify. So again, people may or may not identify with the term transgender. So you may be working with somebody who, might technically sort of fit into that category, but that's not maybe how they see themselves. And I think it's always important to sort of look at, how does someone see themselves as the most important piece in how we gender someone? So a few kind of little tidbits there. Transgendered. So we wouldn't say someone is femaled, right? We would say someone's female. So not saying transgendered. And then also making sure that if we do refer to someone, that we're referring to someone as a transgender female or a transgender male and not as a transgender. So another few pieces around gender literacy. I think whenever we're talking about gender, it's really important to think about safety. It's really important to make sure that we are allowing that person to make decisions about who's hearing about their gender identity and does that feel safe to them. So, thinking about, where are we talking about this person's gender identity, and is there any safety concerns in telling other people about their gender identity, and is that something they even want? So really always just coming back to that person and letting them own, how would you like me to help support you in your gender identity? Are there people that you would like to know or not know about this? Also, I think it can be, for a lot of people and for a lot of gender diverse people that I talk to, I hear a lot about, everywhere I go, I have to talk about gender, and it's exhausting. And I feel like it's my job to be an advocate and to educate people. And I don't really want to be wearing that hat 24/7. So really thinking about, is gender pertinent to the conversation that you're having? Does that really matter in this space, or do we need to put gender kind of aside and not have that be part of the conversation? And being really aware that we're not asking gender diverse people to educate unless that's something that they're wanting to do. So really giving the option of, like, do you want to be talking about this? Or, I can also do my own research, and that's really important. So owning that it's not someone's responsibility to help you learn about gender, but also, kind of having a conversation around, is that something that you feel comfortable or that you would want to do? So the other piece that I hear often is kind of people getting questions about medical treatment and surgery. And as we talked about before, medical transition is part of some people's gender diverse experience and not part of others. It's certainly not a mandatory part or a part that makes someone's gender experience any more or less valid. But I think people often hear, where are you at in this medical process? Have you done this piece? Have you done that piece? And I think that can be pretty invasive and exhausting. So, avoiding those questions unless they are pertinent to what someone might be doing physically, and making sure, if that is the case, that you're asking that in a sensitive way, and making sure, again, with that piece around safety, that you're having a confidential conversation about that. So those are the big a few tips on gender literacy. How do we ask people about gender? So we're meeting people, we don't want to assume their gender. So what do we say? I always try to introduce myself with my pronouns. I think that's a good way to sort of set the stage and create a space. So, I would say I'm Abby, I use she, her pronouns. And then my question to people is always sort of, what name and pronouns do you prefer? And if kids are younger, I sort of say, would you like me to say, he goes to the store, she goes to the store, they go to the store, or another pronoun? I sort of give them some options because the word pronoun might not be very meaningful for them. But you can also ask something like, what would you like to be called? What would help you feel safe in this space? I'd like to use the pronouns that feel best to you. Is there one that you like best? So you will make mistakes in terms of someone's going to tell you something and it's not going to match up with, maybe what their gender identity was or how they identified previously or how you thought about them. So it's particularly, it's a little harder if you knew someone before and now they're transitioning to using different name or pronouns. Or someone might just kind of not match up with your gender expression, expectations, or some piece of gender. And, I will say that I misgender, meaning identifying someone as the wrong gender often. And it happens, and it's part of the process, and it's really uncomfortable and super awkward. And as many kids as I've talked to about this, I think the best practice is just to say sorry and then to move on while using the correct pronouns and name. I think what I've heard is, if you stop and sort of talk about it and try to dissect that a little bit more, that can make it a bigger deal than what it is. And that often has to do with maybe the person who did the misgendering feeling uncomfortable or bad. So, apologize and move on. It will happen. And again, also owning your process. So if you have known someone and they previously used male pronouns for a very long time and are now using female pronouns, I think it's fair to say, I'm trying to get my brain on board. I'm changing things up, using female pronouns. I'm super sorry if I slip up on that. And just owning where you're at in the process. It's okay. And as long as you're trying, I think that's part of what keeps that ball moving. And now we're going to talk a little bit more about, so we talked about how do we talk about gender, language, some of those pieces. What else can we do to create these welcoming, safe environments? So there's so much that can be done to really signify a gender inclusive space before a person even walks through your door. The first piece would be registration, right? So if I'm coming to see you, do I only have choices of male and female on my registration paperwork? That's already going to signify that you're sort of in this space of trying to put me in a box. So one great option is just to have an open-ended category or to increase the number of, different boxes that someone can check, or just letting them sort of put whatever gender identity they want in there. Also on registration forms, are you asking pronouns? So what does that look like? And that could also give you and your staff a good heads up around, this is something that we might have to look at and make sure that we're helping and being supportive around that. And then I think it's one of the big questions I always ask is what makes you feel safe? I think that's such a social work question, but it's a great one in the sense of, what is this person going to need to feel supported around their gender? Because that looks completely different for everyone, and making sure that you know that before someone even walks in the door is really helpful. Also looking at facilities. So are restrooms gender inclusive? Do you have a gender neutral restroom or an all genders restroom? Or what does that look like for, places that people can change, etc.? I think it's really key to note that everyone has a different personal preference with this. So I work with lots of kids who would really prefer to use a restroom where they're the only person in that restroom. I work with other people who prefer to use the restroom that aligns with their gender identity. I think it's important to sort of talk to people and really figure out what makes them feel most comfortable and most safe, and then look at how that works into your logistics and how can you make that the most inclusive, encompassing experience for them. So this one seems kind of probably at this point in the presentation a no-brainer, but using someone's preferred name and preferred pronouns. Another piece that can often happen especially in group situations, is using gender as a divider. So I'd like all the girls over here and all the boys over here, all the women over here, all the men over here. So making sure that we're not really creating spaces where gender sort of keeps people separate, or where we're calling people's gender out. So we could use everyone wearing yellow over here, everyone wearing red over there, everyone's birthdays that are in, odd months here, even months here. I think those are also a really great way to have people make connections and learn about one another. Signage and visual acceptance. So is that mean putting sort of, is that having a safe space sticker as you walk in? Does that mean, creating some of this signage like you're seeing here with all genders welcome? And just making sure that people know that it's a safe and accepting space and that that's visually represented. I think another good place for that is on the website, and is making sure that the website includes information about being gender inclusive. I think for lots of people, that might be sort of a safer way to better sort of judge an organization or better understand what an organization's culture is before physically going there. And so that online presence is important. And then also just making sure that you have policies that reflect gender openness. So, do you have a policy around acceptance and what that looks like for employees and what that looks like for your space? Do you have a policy that addresses, if there's discrimination around gender or any other diversity of human factor, what does that look like and how are you going to approach that? And then also, how does that work in your services? So if someone identifies as a gender other than their birth gender, what classes do they have access to? How does that look? How are you going to handle that situation? And it becomes really important to think about those things before the moment. And I think knowing that can really help set you up for success and help set your staff up for success. And also in feeling like they have some good solid footing in terms of how to make decisions. So how do we take these gender pieces and put them more in this equine setting? And what does that specifically look like? So one thing that can be really helpful is to talk about gender norms in this context. Are people using gendered language or making gendered assumptions? How is gender playing out in this space? And can we use this space? Can we use this interaction with horses to sort of therapeutically move forward this expansion of seeing gender? Or just sort of calling out, hey, can we shift this from this to that? So great space to look at gender and to help people expand their thoughts. I work with so many young people who feel disconnected with their bodies and whose dysphoria has sort of shut them down from experiencing joy from their body or even feeling connected and resonant to their body. So what an incredible and powerful experience to use equine therapy to help people reconnect to their body and to help people feel more secure and safe, and use that as a partnership to help people feel more aligned and more in tune with themselves and their body. Also important to recognize that as we're talking about people moving their bodies, that can actually cause some dysphoria. So for somebody who identifies as male and has, a more significant amount of chest tissue, that riding a horse might actually be a little bit uncomfortable, and acknowledging that and acknowledging are there things that we need to do differently in this situation to help you feel the most comfortable possible. Horses have such an incredible gift of being able to see people's authentic presence, of being able to see through some of the stereotypes and norms and all of the things that we as humans sort of get in the way of that authentic connection. And so I think in that way, it can be a really resonant, beautiful experience for people to be seen as they truly are and really acknowledged for that. And then also to think about, how are you talking about a horse's gender? So when you introduce horses, one of the beautiful things is that they have a lot of masculine and feminine qualities, and that their anatomy and their personality are often very different. And so I think we can use that as a teaching point, right? So do you even need to gender the horse when you introduce them? Or can we introduce them without gender and allow their presence to be there as well? Or can we talk about how maybe their personality and their anatomy might be different? And does that make someone feel more connected to them? Or can that be a teaching point? So just a little bit about what we do here at the True Center for Gender Diversity, in case there are people, particularly here in Colorado, that might need some assistance. There are a number of pediatric gender clinics around the country, as well as clinics for adults. We see people for hormone blockers, so for young people who have a strong gender identity that is not aligned with their birth sex. We can actually put a pause button on puberty until they're old enough to start those gender-affirming hormones. We help people with social transition, family support, and education as well. I think one thing to keep in mind is that there's a lot of data that shows that people who go through social and medical transition, or any combination of that works for them, that a lot of those initial kind of factors that we talked about around mental health and some of those other risk factors reduce. And we know that that's very much so true for people who transition early in life. So we consider what we do to be preventative medicine for people's whole health and mental health, and to help them feel more aligned in their body. If you have any questions or would like to refer to someone, our number is there. And then wanted to give a few more resources. Some of these are, again, a little bit more Colorado specific, but some of the more national ones are WPATH, that's the World Professional Association for Transgender Healthcare. And Gender Spectrum is also a really amazing website that has a ton of different resources on a number of different subjects. And then the rest of these are Colorado specific and more Front Range specific for any of you there. So I hope that this has been informative and helpful and giving you a little bit more of an understanding of what gender is and how you can create gender inclusive spaces. And again, I really appreciate your time and your willingness and openness. Thank you.
Hi, everyone. This is Abby Simon. Thank you so much for attending this session. I hope it was informative. I got a couple questions throughout the session that I'm just going to read the questions and then talk through some answers. So the first question is, as a novice instructor working with gender diverse riders, do you think a group model would be helpful, would provide that support system so they have another person with similar experiences to work with? I think the biggest thing with this one, group models are fantastic when we're talking about gender because I think they give us a space to really help people normalize that experience. So I think you as the instructor in that environment can really create a supportive space and let people know that gender is okay. I also think that it allows people to interact with different gender diversity in a way that's helpful. So yes, I do think it definitely creates a support system. I think it's important to set up some ground rules and some expectations around gender and making sure that everyone feels safe and respected. I also think it's important to have some consistency around gender identity. So for instance, if there's somebody in one of your groups that maybe uses they, them pronouns or has a gender expression that is different than, what might appear, that you're asking everyone in the group you're asking everyone in the group what are your pronouns, or you're asking everyone in the group how they'd like to be identified and not just singling that one person out. I think that's kind of the biggest piece that I hear from people in these environments when those experiences are negative, is that it becomes about their gender identity and their gender diversity rather than being about the gender diversity of all people and the understanding that we all have different pieces of us that are gender diverse. So the next question was about some adolescents have come through our program and refer to themselves as they. Can you explain the psychology behind this and how this is a safer pronoun to use? Are there others? We talked a little bit about this in the presentation. So I think they is used for a number of different reasons, and I'll just dig into that a little bit more. So I guess my first piece would be that probably everyone uses pronouns for different reasons. So I'll give you some overviews, but people will likely have more specific reasons. The first would be somebody who doesn't believe in the gender binary. So they say, I don't think there's just male and female. I would actually like to exist outside of that system, and I don't want to identify either as male or female, and I prefer they as a term that acknowledges that I'm outside of this male-female binary. For other people, it's that they feel that there are times when they feel very feminine and times when they feel very masculine. And the word they for them sort of encompasses both of those experiences and the diversity of kind of both of those in one. I think for other people, it does really feel like a safer pronoun because it acknowledges that they maybe are just not in a space maybe they're in a space where they're questioning or they're exploring, and they sort of denotes to other people that that's sort of where they're at in their process. There are other pronouns that people use. Z is a pretty common one. These, they. Some people have other pronouns that feel particularly important to them. The piece with that generally, when people give me pronouns that I have not heard yet, is just do a quick Google in terms of understanding that grammatically and although this is not a totally ideal thing, you can also use people's names a little bit more than pronouns. It is very possible to speak to people without pronouns. So if you feel like the pronouns are really tripping you up, you can just say, hey, Sam, please go do this. Great job, Sam, instead of great job, them, great job, he, great job, she. That can be a little bit easier for people, although if overused, people can feel a little bit, I guess, feel a little disrespected by that sometimes, but it's better than misgendering someone, I would say overall. Sorry, just pulling up the next question. So the next question was, can you let us know the ages of the individuals that you see? We actually see in our clinic people ages 3 to age 25. And the care for people at different ages looks incredibly different. So overall, just kind of the quick piece on that is that for people who are pre-pubertal, who've not started puberty yet, a lot of the care that we provide and a lot of what we're doing in terms of gender work is, letting people express themselves through their gender expression, right? So that's not necessarily body related. We know that bodies before puberty look pretty similar, and that's a lot about what is this person thinking, what is this person saying. So it is actually kind of statistically more common that if people don't identify as their gender assigned at birth before puberty, that they are more likely to not have that be a long-standing gender identity. So you may work with a 5-year-old who identifies as male, and then at some point goes, actually, I really realize that I do identify as female, but I like some of these masculine things, I like some of these feminine things, etc. So the message that we're always sort of reiterating is that gender is a journey, and it's okay. It's okay to feel like you're not the gender you were assigned at birth. It's okay to feel that you are the gender assigned at birth. It's okay to explore gender. It's okay to change your mind. It's okay to think that process through. So I do meet some people who feel like there's actually a lot of shame sort of after navigating to one gender and then maybe navigating to another space. So we always try to really hold that space of, this process is your process and you can own sort of any part of that. We know that people who identify as a gender other than their birth gender, sort of at the age of puberty or over the age of puberty, that does tend to be a more long-standing gender identity, and there is less likelihood of people, what you would quote-unquote call detransitioning or sort of having as much movement in their gender identity. And obviously, from a medical perspective, that's when things get a little bit more serious medically, because that's when we're helping people sort of look at the choices that they have in their body and potentially starting hormones and some of those other sort of irreversible medical treatments. But I will say that people transition and people explore gender at any age. Another question is, can you talk more and give examples of how not to gender a horse? So I think that would be language like, look at this pretty girl, or look at that strong boy, or, just sort of ascribing kind of what we identify as feminine or masculine in that process. So making sure that, we're not saying that we're not sort of adding these cultural expectations to a horse because of their gender, which I think we do with people and animals, just in terms of saying, okay, I think this horse's gender, or I know this horse's gender is this, and because of that, I'm going to treat you in a way that's more sweet because you're feminine, or I'm going to expect this horse to be stronger because you're masculine. So I think it's more of just sort of pulling away those gender norms and doing that both with the people that you work with and with those animals, and then also sort of acknowledging that with people, with humans, we have kind of an easier way of telling people's gender, and that for gender diverse people and for all people, it can just sort of be helpful to approach that experience in meeting a horse without those gender expectations immediately, as sort of practice for doing that with people as well. Sorry, just making sure there's no other questions that I did not answer. So someone wrote in that they're working with 2 boys in middle school, and this and gender has become a topic of discussion in our home. And as a parent, it can be overwhelming to keep up, and I find myself referring to Google terminology. Is there a specific site that you recommend to help with this ever-evolving topic? You and me both. I mean, I think what's really amazing about language in reference to gender right now is that it's changing so rapidly. And I think part of the reason that it is changing so rapidly is that we're actually like building and creating new words to really pinpoint people's experiences more specifically. So PFLAG has a really great list of like a really good glossary. Any of your local sort of LGBTQ advocacy organizations do. I tend to use the PFLAG one most often, but I would say that, or also GLSEN, which is an educational advocacy group, has some great resources. And then the other one is Gender Spectrum. So Gender Spectrum kind of has a treasure trove of all things gender, and I'm sure has a very current list. And then again, my whenever I get a term that I don't know, my first question is always, tell me what that means to you. So we have people come in our clinic often who say, I identify as transgender, and it's really interesting to see how often those experiences don't match my definition of transgender. So I always try to just get from people what is their experience of that word, because that's most pertinent.
Okay, Abby, this is Lillian. Thank you so much for your informative presentation today. We are unfortunately at the end of our presentation time, so I'm going to formally close out the meeting. Again, thank you so much, everyone, for participating. We loved all the feedback, and we had a great time here today. Make sure to stick around for our next presentations. So this concludes the presentation program. Thank you so much, and make sure to enjoy your next session.